Well, welcome everyone. Our virtual support group meeting is really glad that we're really glad that you're joining with us today, and we have a great speaker with us, Dr. Catherine Lee, who's going to help us learn more about mediating all those difficulties that we come up in caregiving and in life. So we're really glad for that, and we're glad that you're able to be with us. And I want to remind you that next month is one of our open forum support groups. So we'll be having a time where you can ask anything, talk to each other, bring ideas together. And it won't be a recorded session. This will be a recorded session. So if there's part of it that you do miss, then we'll have that up on our YouTube channel within just a few days. So let me introduce Dr. Catherine Lee. Dr. Lee has a background in Asian studies and international education. She earned her PhD in educational foundations and graduate certificate in peace and conflict resolution. Isn't that wonderful? From the University of Hawaii at Manoa, and has an executive certificate in leadership coaching from the Institute for Transformational Leadership at Georgetown University. Dr. Lee earned her associate certified coaching credential from the International Coaching Federation and is a member of the Singapore chapter of ICF. Catherine has worked in both the corporate world and academia as a trainer and executive leader. She's traveled all over the world, staying for long-term work in Taiwan, China, Japan, Bangladesh, after having done a one-year study abroad program in Paris, France, as a university student. She has an international perspective on human psychology. As a teacher, her goal has always been to empower learners to seek knowledge for their personal development. Her expertise lies in the domain of leadership development and effective communication. Catherine started at the Mediation Center of the Pacific in 2008 as a volunteer mediator, and in May of this year became a member of the staff not only as a mediator, but also as the program development director. And we are really honored to have you with us, Catherine. We appreciate it, and we're looking forward to learning about the Mediation Center and especially about the Kupuna program. So
Thank you,
turn it over to you.
I really appreciate that nice introduction. Hi, everyone. It's nice to see you here. And I'm going to share a little bit about the Mediation Center of the Pacific, as well as the Kupuna program. And to do that, I have a PowerPoint presentation, which I'm going to share now. If you could just confirm that you can see it, that would be great. Okay, great. Okay, so let me go ahead and get started. So the Kupuna program was developed to help families to engage in difficult conversations. But what does that really mean? If we look at the history of the Mediation Center of the Pacific, we go all the way back to 1979, and in the Neighborhood Justice Center, you might remember that. And over the years, it has emerged, and through having been the first mediation organization in the state, it then became a 501c3 not-for-profit organization and serves about 15,000 people annually at this point. So many years, a long journey, and lots of mediators. So our mission is to provide high quality, affordable, and accessible mediation and dispute resolution services. So just to give you an idea of what kind of cases we handle at the Mediation Center of the Pacific, we have the Kupuna program, we have civil rights cases, domestic cases, consumer merchant, employment, landlord, tenant, and special education. So we really serve the whole community when it comes to different kinds of issues that come up. Our services result in lower community support costs, reduced medical care expenses, assurance of chronic disease management, additional community income, taxation revenues from benefit programs, savings in housing and support costs for homeless families, but a huge program during the pandemic where we were able to really serve people who were on the verge of being evicted, and that continues to today. There is a savings, a measurable savings in the community law enforcement, court systems, and other government agency costs. If at any point you have a question along the way, feel free to ask me, but I'll be happy to field questions at the end. So let me just tell you a little bit about our Kapuna Pono program. The goals are to clarify the needs and desires of the elder within the family system. We also, after getting together and talking to everyone in the family, we develop a family plan to support his or her needs. And that family plan has some basic elements: support for instrumental activities of daily living, like shopping, housekeeping, finances, support for activities of daily living, feeding, bathing, toileting, short and long-term living arrangements, end-of-life decisions and preferences. So what we do is we talk to family members during the intake process to understand what all the issues are that the kapuna is facing and the family supporting that kapuna are facing, so that we can come together. We have a very comprehensive idea before we even go into the session, through many conversations with the family members, either on Zoom or over the phone. So we make sure we understand everything that is important to the family. We also plan for the early stages of life. So this is really a lifespan conversation that we're having with people. So what we're finding is that the failure to talk about these things really is a recipe for conflict. And if I just share a personal story of my own, I was in a situation with my mother and my brother, both of who had a situation in the hospital where they were rendered incompetent. They could not make decisions of their own. And as a result, I, as the next of kin, had to make a lot of really painful decisions that I wasn't prepared to make. And when I came and joined my PhD program, I had an opportunity to be part of the Quentin Burdick Rural Health Program that was through the School of Nursing up at UH. And we could go out in the community for a summer program and help one of the communities in the neighbor islands to come up with something that would be helpful for them. So we started by interviewing, talking to the kapuna in the community to find out, how can we serve you? And we didn't come with a pre-packaged idea about what might be good for them. And in this particular community that we were serving on the island of Molokai, they came up with wanting to have something that had to do with serving the kapuna, who I didn't even know that there was medevac insurance on Molokai, because if you have an emergency, you have to be flown over to Maui or over to Oahu. So everyone has this medevac insurance. I'd never even heard of that. And so they said, if something happens to me and I have to be flown to Honolulu, my whole family is going to want to come with me. It'll be a tremendous expense. They'll all have to stay in hotels. Everyone will have to pay the transport. And so if I could have something like an emergency card and an advanced healthcare directive, that would serve my whole family and I could die in peace. And so that's what we ended up putting together for that community. And so it was back then in 2009 that I realized the importance, actually that was 2007, of something like this. So I really believe in having the conversation early with all of the stakeholders so that people can understand, what do you want to do, and what's important to you. So I just offer that as an example from my own personal life and what I've seen in the community so far. So this conversation is really important. And when you don't have the conversation, you may yourselves know what that can be like when you're faced with these big decisions. So I think clarifying expectations takes a lot of courage. It's not an easy conversation to have. And sometimes people are fearful of the conversation. And it seems easier to act as though differences don't exist, and sometimes to cover it up and hope that things will work out, than to face the differences and work together to arrive at mutually agreeable sets of expectations. I see some of you nodding your head, so I think you do understand what I'm talking about. Because the fact is that we are all living longer. And this is a pretty obvious thing when we look at the facts. With the medication that we now have available to us and the health care that we have available. We're living longer, and dementia is something that we're facing. For people over 65 years old, 3 to 5% of us can expect to have a challenge with dementia, and those over 85 years old, the percentages go up to 40 to 50%. So the cost of caregiving is something we really need to plan for, because otherwise we know that it can be very financially and mentally draining. And most families are not having these conversations earlier, and they're finding that they're in very stressful situations when it comes right down to the wire. So let's just look at some of these statistics. I won't read them one by one. You can take a look at what's happening. But as these numbers and these percentages go up, we have to plan ahead. Unfortunately, we have the support of our state also looking at these issues and trying to find some policies to help us support these changes. So some of the challenges that we're facing for delivering elder care include, unfortunately, family conflict. So when you have people who want to try to let the elder person age in place, as it's commonly being called today, that requires some support. And very often what we're seeing is that the children, or what we see, the sandwich, kind of, people are calling it the sandwich generation, where we have caregivers who have their own families, their own children that they're taking care of, while at the same time they're trying also to take care of their aging parents, sometimes in the same house, sometimes in separate households, but also trying to work a full-time job and do all the things that are necessary to take care of their younger children. So we see this at the Mediation Center of the Pacific, that conflicts between the siblings and the other family members are arising. And this can really result in a lower quality of care for the kupuna. It can result in elder abuse, which is something very unfortunate that is a reality. Poor physical and mental health of the caregivers as well. There's burnout. I'm sure some of you have seen this. And irreparably broken family relationships. So when it gets too far down the line, sometimes it's hard to turn around. So with the lower quality of elder care, you see that there are increased physician visits, increased ER visits, increased readmission to the hospital, longer hospital stays, and increased needs for medication, all which can be costly, not only financially, but also for the caregivers having to go back and forth to the doctor's appointment in the hospital, etc. So the Kupuna Pono program is a program that is designed to help families talk about these difficult issues and develop transition plans to support elderly family members. And the way we do that is through family conferencing, through the guardianship mediation program, and through mediation. And so we can find out exactly where families are when we start with a family conference, bringing everyone together to support the kupuna. What does the kupuna need? What does the kupuna want? And then we can, through that conversation, which is generally, the first session is 3 hours, we schedule it for 3 hours. And we can, through a third party neutral, which our mediators are, 2 mediators are there together to support this conversation. We can see, okay, we can identify the issues together with the family as they're laying everything down and saying, okay, now what do you want to do to move forward and make a plan with all of these pieces, putting them on the table. We might see over here that there's a really tense issue that might be financial, it might be a relationship issue that we can pull aside and say, okay, we're going to create a separate mediation session for this issue. And so we may, after the first 3 hours with the family conference, then set up a separate session. Maybe not all the people from the family conference have to be in it, but maybe those 2 siblings need to come together and sort out this issue so that the family can move forward. And what we're seeing is that the outcomes from having such opportunities is preserving family relationships, maintaining the dignity of the older person, clarifying the real issues and interests of all the parties, enhancing the family communication and collaboration, developing plans to share decision-making and caregiving responsibilities. working with professionals and outside resources to create flexible, realistic plans, and to gain an appreciation of each other's perspectives and concerns. So what I've seen is that there's a real sense of empathy that gets developed through having these difficult conversations and coming out on the other end with a little bit more kind of aloha toward each other. So the underlying premise of the Kapunapono program really is finding that balance, right? The balance between the independence that we all cherish and want till the end of our life and the safety that we all need throughout our lifespan. So this is what we're trying to balance for each and every person who comes through the Kapunapono program. So the guiding values that we follow for the Kapunapono program are respect, self-determination, empowerment, informed consent, confidentiality, and impartiality. So the areas that we're finding that are important for discussion and decision-making tend to fall into these areas, although these are not all of them, but medical care, living options, safety, home repair and maintenance, eating and food preparation, support and caregiving, socialization, healthcare and financial decisions, financial resources, and end-of-life care. And there probably are more, but I'm just giving the high-level categories that we're seeing in the Kapunapono program. The areas of possible or potential conflict within these areas, the quality of care that the Kapuna receives, finances, decision-making, and personal relationships. And I think if you just sit for a minute and think about your own self and your own family, you might even be able to start to imagine in these four categories where areas of conflict are affected. So the underlying issues that may lead to these outbursts of conflict or the development of conflict could be different values and expectations. We just assume like, oh, these are our family values, but every person within the family system, they each and every one of us have different values and expectations. We can't assume to know that we know what mom wants. We may think we know what's best for mom, but we need to find out from mom what's best for mom. Unreasonable expectations, different roles and responsibilities will shift throughout the lifespan, confusion, frustration, personality clashes, blame, guilt, changing roles, changing lifestyles, loss of control, uneven division of labor, family history, different levels of acceptance. I don't know if anything rings a bell with you, but I sure can recognize a few things in my family system from this list. Certainly one of the very real fears felt by anyone with Alzheimer's is the fear of failure. I live with the imminent dread that one mistake in my daily life will mean another freedom will be taken from me, from Robert Davis, from my journey into Alzheimer's. This has become more and more of a reality for all of us. Tracy, our executive director, in all of her training, she loves to put in comics. So I hope you can enjoy this and get a little laugh, a little comic relief from a pretty heavy topic. So Ruth, who has Alzheimer's disease, says, "We will talk about it. I will listen, but you must talk with me about it so that I can make an informed decision. It's my decision." This is the thing that we really want to reinforce. It's the decision of the Kapuna that comes first, and we want to support that. So mediation, it's confidential, first and foremost. All of us sign confidentiality agreements. Everyone has to sign one before we can even start the process. It helps participants in conflict to talk and negotiate solutions. So it's not about blame in the beginning of the conversation. Definitely, whether it's Kapunapono or any mediation, emotions are high. The stakes are high, emotions are high, and we give space for people to share their story and how they're feeling, because that is essential to let this space be a safe space where people can share. And once they do that and they feel that they've been heard, then people are ready to move to focus on the issues of the conflict and find some common ground and hopefully negotiate agreements that will meet all of their needs and interests. So it is a process. So let me just talk a little bit in general about the mediation process. It starts with the convening. So this is the intake. So when you have someone who calls the Mediation Center of the Pacific, maybe they've been recommended, or maybe they've taken the decision themselves to reach out to the Mediation Center of the Pacific, they'll be talking to our client services specialists. And this is what's called the convening stage, where we understand the situation, we understand what are the conflicts, what are the things that the family would like to accomplish, and we start to understand the story. So that's the convening part. Then after we have everything mapped out and everything is planned very diligently before the actual session happens, and it happens at the Mediation Center of the Pacific, and the mediators are selected based on their expertise. And we come together in the room, as I said, for a 3-hour session. There's an opening, so we want to understand everyone's point of view. Everyone gets a chance to share. We're gathering the information. Everyone's listening respectfully. There are ground rules. And we may have some opportunity to have little separate sessions, but generally the family conferencing is that everyone is staying together throughout the whole session. Hopefully we can get to a point of some negotiation on the issues once there's some common ground established. And if possible, it can happen sometimes in the first session that you write up an agreement. And that happens not because the mediator is telling you what to do, because the mediator is facilitating the conversation, not judging. The mediators are not arbitrating. They're facilitating the conversation for the family. And if they say, okay, we agree on this, and this. This is the plan that we'd like to put together. Then this is memorialized in a document that the mediators help to type up. Everyone reads and contributes to. We print it out and everyone signs it, and that everyone takes with them. And then there's a closing. Now, it may not happen that you can finish in one session. You may have to come back for another session, or 3 sessions, or 5 sessions. It's fine. And very often people say, I want to stay with the same mediators if it's possible, because now they know the story. So as we do everything that we can to respect and accommodate that. When you start with 2 mediators, you say, I feel fine with these mediators. I want to keep going with them. Or you might say, I'd like to have new mediators. It's completely flexible and up to you. So as I said, with the family conferencing, the goal is to help families talk and create family plans that support the needs of the elder family member. And the underlying principles of that is that families have strengths. So this is a strengths-based approach. The strengths that can be tapped can be catalysts for positive change. So we want to focus on those strengths in the family, because strengths help resolve issues and concerns. Strengths are enhanced when they are acknowledged and celebrated, I might add, because families have the keys to their own stories. Families are capable of making their own decisions. And like mediation, I'm such a strong believer of mediation, because people can come up with their own agreements. So this is very often why, this is why the courts send cases to mediation, because they only have so much time. I'm talking about, domestic cases, district court cases. They send them to mediation because they only have a short amount of time, and people's lives are precious. And they know if they go to mediation, they'll have time to work out their own agreement. So the benefits: enhance family members' decision-making abilities. It's all about empowerment, building cooperative relationships, assisting the family with the context of their own culture. Families become more self-determined and it provides a safe environment for sharing information. So I'm not going to read this word by word. Maybe you can just spend a couple minutes looking over it, but the family plans for the vulnerable kapuna, the dependent kapuna, or a kapuna at the end of life have different components to it and should always be updated. So maybe you can just take a minute and take a look at this. So as we know, there are a lot of pieces to the puzzle, and there are a lot of things to consider. So these are the things we want people to really cover and be thinking about even before they come into the family conferencing. So we can sit down and we can map out a plan for the family that is driven by the family and the values of that family. So the pre-planning is key to identify the purpose of the meeting. We want to be very clear about why we're having a family conference. We want to prioritize the key issues. What phase is the family at in all that we've looked at so far? Where exactly are we in the whole stage of the game? Are there legal issues involved? We need to understand that. What resources have they accessed? What resource do they still need to access? Or what should they do first? And very importantly is we want to learn about the family culture. During the meeting, we want to ensure that everyone participates. We want to provide family time that's private. We want to capture the group memory, the strengths, concerns, needed resources, the plan, and the next step. So there's a heavy recording of documentation of what's going on at each part of this family conference so that it can be turned into the plan and the agreement if that's what it ends up being. So during the conference, we have introductions, we describe the process description and review of the purpose of the family conference. We review the agenda. We do have ground rules, as all mediations do. Each person provides an adjective to describe what makes their family unique. Each family member provides an adjective that describes the elder person. The elder person provides an adjective that describes their children. The elder person shares what is important to them, and then we move through the agenda items. Some additional steps that may be required or that may be desired raise non-agenda issues. So it may not have been in the plan for the family conferencing, but maybe the kapuna says, I want to talk about end-of-life issues. I want an advanced healthcare directive. I don't have one yet, but it wasn't on the agenda, but we're going to address it. If that person wants to talk about funeral arrangements, we're going to talk about it. And the ways that we can do this is we can keep very good notes. We can use a parking lot. We can identify who's going to be responsible for each action step, determine how the conflicts and or unresolved issues should be addressed, and encourage the family to agree on a future date to review the plan. So this is ongoing. And that kind of tells you, mediation and family conferencing is really about preserving relationships, to maintain the dignity of the older person, clarify the real issues and interests of the parties, enhance family communication and collaboration, develop plans to share decision-making and caregiving responsibilities. It incorporates professionals and outside resources to create flexible, realistic plans, and helps the family members to gain an appreciation of each other's perspectives and concerns. So it's really all about choices. When families talk and plan early, the elder person can actively participate and make their own choices. This is what each of us would want, and this is what we would want for our kapuna. So I have come to the end of the presentation and I have my contact information here. You're more than welcome to reach out to me if you know someone who could benefit from the Kapuna Pono program. If you think this is something that would be beneficial to someone in your family or anyone else, I'd be very happy to support you in any way that I could. So with that, I'm going to stop sharing my screen. And if you have any questions, I welcome any questions. I'm very happy to see Rick here and Tom, our wonderful mediators from the Mediation Center of the Pacific. Just wanted to give a shout out to both of them. Thanks so much for being with us today. We so appreciate you. And the cost of the service is $250 for the Kapuna Pono program when you come in for a 3-hour session.
Okay, so Catherine, I have a couple of questions for the video, and then we'll turn the video off, and maybe our caregivers would like to talk about their family situation. So could you go back to the ground rules of mediation? What are some typical ground rules?
Yeah, ground rules in any mediation is that when one person talks, we're all going to listen. We're not going to interrupt that person, and we are not going to be belligerent or use language that's demeaning in every way. We're going to be respectful to everyone in the room, and we're going to come at it with goodwill. Those are the basic ground rules. Now, if we're on, mediation, if there's a video, like we're on video like this, there's some different technical kinds of ground rules that we might go over with the folks about the confidentiality. We always stress the confidentiality, and confidentiality is the kind of the cornerstone of all mediations. Is everyone has to agree to the confidentiality. Mediators cannot be subpoenaed to show up into a court of law, and within confidentiality, there are some exceptions. So if we hear that there's any kind of elder abuse or child abuse or any violence involved, that is the exception to confidentiality, and we are, by law, we have to report that. So these are the kinds of ground rules, that we're all here for 3 hours. Does that work for everyone? Is there any reason that anyone can't stay for 3 hours? This is sort of the general set of ground rules that we use in the mediation, where it's about safety and preserving people's confidentiality so they can feel safe and share safely.
Okay, thank you. And
So could I just interject real fast? So we're doing Zoom and we're also doing in person. So if we're on Zoom, Thomas or Catherine and I, we're always asking, are you alone? And making sure that there isn't somebody else in the background somewhere. They're not to be recording this stuff, that kind of thing. So what happens in the meeting stays in the meeting and does not go out. We don't go to court or any of that kind of stuff. So it just stays confidential within the family and with the people doing the mediation.
Okay, that's
Thanks
a
for adding that, Rick.
good point. Yeah. What if there are reluctant family members? And are you able
so
sway
mediation,
them in?
you have to want to participate as voluntary. We can't force anyone into mediation. It's a voluntary process. And those who feel compelled and volunteer to participate, they are the ones who come. Now, not every family member is going to be willing to do it. We can't force them. Nobody can make them come, but hopefully, through our intake and through the conversations that we have with all the stakeholders, they will understand what it is, because sometimes people are resistant because it's unknown, or they think it'll be like going to the court. And people will, they'll reject that. But if they understand this is not the court, we're not judges, this is your process, we're just facilitating the process. If people can understand what it is by this opening in the beginning, when we talk to them, convene with them, usually people are more willing because they understand, okay, so this is what's going to happen. But we do have to explain what's going to happen if we want people to feel comfortable.
Okay, a really good question in the chat. Are the mediation services available on Maui and other neighbor islands?
Yes, on Maui, there is a mediation center there. There are 5 mediation centers throughout the islands that make up one, one umbrella under which the 5 of us run, and there is one on Maui, yes.
Okay, excellent questions. I think what we'll do now is wind the video down so that we have a private space.